Good afternoon, everybody. I'm Dr. Kevin Lewis, and I'm here for your next weekly wellness tip. I hope you're having a great Wednesday so far for those of you that are watching this live. For those of you that are watching this on replay, I hope you're having a great week. You're halfway through with the week, so I hope it's going great, and I want you to finish strong. For those of you who know, each week we do a wellness tip here at the office and give you some advice based upon a question that a patient's asked me in the office. And earlier this week, a patient asked me, hey doc, what causes arthritis? So I thought I'd take a moment and discuss what causes arthritis and what you can do about it. Now, arthritis is a general term for any kind of, for many types of joint, bone, and soft tissue diseases. There's two primary categories. There's inflammatory and there's degenerative. Now, there's some crossover in these, so bear with me on that. The inflammatory arthritises or arthrotides would be things like autoimmune conditions, so like psoriatic arthritis and other arthritises like that. These arthritises are due to a breakdown in the immune system where the body starts attacking itself and destroying the joints. The other type of arthritises or arthrotides are degenerative arthrotides. And these are things that occurred usually due to trauma or long-standing aberrant motion. So let me show you what I mean. So in the spinal joints, so I've got a model here of a spinal joint. What we're looking at is we have one motion unit or one kinetic unit that is made up of two vertebrae with the disc in between. Now, the purpose of these vertebrae are to, obviously, it's a hard bone as a shell or a casing around the spinal cord. So you can see here that the spinal cord runs down through the middle and branching out the spinal cord are all these spinal nerves. And the bone is there to protect those structures and keep it safe and it gives structure to the body. The disc is there as a spacer primarily to hold the bones apart so the nerve can pass through. And if you look up or lean backwards, the bone should move backwards. And if you look down or lean forward, the bone should move forward. Same thing if you lean to the side, the bone should tilt and rotate, and if you lean to the other side, the bone should tilt and rotate normally. And that works well, and that functions well. Now, sometimes forces can enter into the body, a fall, an accident, a car wreck, a sports injury, or maybe it's just poor posture. Maybe you have daily poor posture, things like that, and it can shift one or more of the bones out of their normal position, and then they get stuck. Now, instead of protecting the nerves, the bones are putting pressure on the nerve, damaging them, and we lose one or both of those movements. Now, when we lose that movement, it changes the mechanics of the spine. You see, the disc stays hydrated as long as fluid is getting pushed into the disc, so water, okay? So the water is actually not fed into the disc through arteries or veins, like many other tissues are fed with arteries. It's actually pushed through the bone, so the end plate of the bone above and below, okay? Now, as long as there's fluid in the body, so you're well hydrated, and as long as the bones move normally, they're not stuck in an abnormal position, that disc will stay hydrated. Now, let's say that an injury does occur and the bone becomes stuck in an abnormal position. Now the disc is no longer becoming hydrated and things begin to break down, okay? Here, in this model, you can see that the disc has thinned significantly. Inside the joint, the disc actually delaminates and starts to break apart. You can see this breaking apart here. When the disc thins like this, there's less room for the nerve, so there's more pressure. That's more pain, there's more tightness in that area or wherever this nerve feeds. So if this nerve goes to the legs, you might have pain shooting down the legs or pain in the foot. If this nerve is coming out of the neck, you might have pain in the shoulders or down in numbness and tingling in the hands, things like that. So there's pressure on that nerve, there's more pain, there's more tightness, and the disc has gotten thinner here. This kind of breakdown can take anywhere from 1 to 5 years on average, give or take. Everybody's a little bit different, but 1 to 5 years of breakdown after the original incident occurred. Now, if that's not treated, if we don't restore motion to that joint, it continues to break down. That is arthritis that's occurring. And that's what you can see here in this next phase. And you can see here that there's now even less space for the nerve. The disc has gotten thinner there. And we start to get all these jagged edges. Those are bone spurs that are forming here. And what those bone spurs are is actually calcification of the ligaments that run between the two bones. And what the body's following is two laws called Wolff's Law and Davis's Law. Wolff's Law says where bone is needed, bone will be deposited, and so the bone structure changes. And Davis' Law says a similar thing involving the soft tissues, that the soft tissues will change based upon where those stressors are. So due to the loss of motion here, this is starting to break down even further. And now you can see that there's pressure on the nerve even further, and so now the nerve is actually getting even thinner. You can see the disc is breaking down even more. This is also where a lot of disc herniations occur. And as the nerve gets thinner, this is where the pain travels, let's say out of the neck into the shoulder, or down the arm into the hand, like we were talking about a minute ago, or out of the low back into the leg and things like that. This process right here takes anywhere from 5 to 15 years, on average, again, from that original incident that injured the patient. And again, if motion's not restored to the joints there, it continues to break down even further. This degenerative arthritis occurs, or this spinal decay occurs, and then it looks like this. And in this phase of decay, there's very little disc space left. It's almost bone on bone. Then there's all these bone spurs that are growing here. The disc is almost completely dried out, and you can see that the nerve is extremely thin. So this is where symptoms like numbness and tingling, hard time getting around, we're just not functioning very well at all anymore. That's where this stuff comes in. And this is somewhere 15 to 25 or more years after that original incident that breakdown occurs in many people. Now, obviously we can't get this back like this, but this still is in many cases salvageable. Now, there is a next step after that where it's complete fusion, it's bone on bone. And at that point, surgery is usually the only option for most people. Some people, there may be injections and things like that, but in many cases, surgery is the only option. So what can you do if you have this kind of arthritis, this degenerative arthritis occurring? What are some of the things that you can do? Well, first of all, staying well hydrated. There's several studies that show increasing water intake will help hydrate those tissues. And of course, we know if the disc is not hydrated, first we have to have water in the body to hydrate that disc. Restoring motion to the joints will help imbibe those joints with fluid more. So the water will be pushed from the end plate of the vertebra above and below into the disc, rehydrating that disc. So how do we restore motion to the joints? Well, stretching sometimes can help, but many times spinal adjustments, going in with a chiropractor and moving the bone off the nerve restores proper motion, and now fluid can be pushed into that disc and helping it heal in a natural way without the use of drugs and surgery. We recommend when we have that and we have an acute flare-up of arthritis, we recommend icing when it's acute flare-up. So when it's hurting, we recommend ice to reduce that swelling. We do recommend heating the tissues beside there, so the muscles beside there, so you could use hot packs on either side of the joint where the muscles are to reduce that tension, and then afterwards using ice on that area to reduce the swelling in the joint. And then finally, you can take supplements like glucosamine conjoint and have shown to be beneficial in helping rebuild that joint. Now, regardless, if the joint is fixated, if it's not moving, it will eventually break down, so we have to find a way to restore motion to it. Here in my office, we do a motion study x-ray because we can actually see that on the x-ray, that loss of movement. We can see it, measure it, know exactly where to treat that, how to treat the patient, where to treat the patient, and give a reasonable expectation of how long we would need to treat that patient. So I hope that gives you some questions on how arthritis occurs, especially degenerative arthritis. We don't have enough time to go through all the inflammatory arthritis and autoimmune, but if you've got any questions, please post them in the comments below. I'll be more than happy to answer your questions and give you an answer if I can. I hope you guys have a great week. We'll see you back here next week for our next question. See you later.